Hi, welcome to Pharmacogenomics in Practice. I'm Jeanette McCarthy. In this course, we'll explore the theoretical and practical aspects of using pharmacogenomic tests to guide treatment decisions. I'd like to start out with a case report. The case is a 9-year-old boy who was diagnosed with ADHD, OCD, and Tourette syndrome. He was prescribed a combination of methylphenidate, clonidine, and fluoxetine. He began to develop nausea, vomiting, and headache, and within the first 10 months began to show signs of metabolic toxicity, marked by GI distress, low-grade fever, incoordination, and disorientation. He developed generalized seizures and eventually lapsed into status epilepticus, followed by cardiac arrest, and subsequently died. The question is, could this have been prevented? It turns out that most SSRIs are deactivated by the enzyme CYP2D6. Upon autopsy, the fluoxetine blood concentrations in the child were several-fold higher than expected for overdose situations. This led the child's adoptive parents to be under investigation by social services to determine their level of control for medication access. However, upon genetic testing, in the autopsy, it revealed that the child was a CYP2D6 poor metabolizer. These results effectively ended the investigation of the adoptive parents. This is the first confirmed report of a fluoxetine-related death of a child from impaired drug metabolism. Pharmacogenomic testing could have alerted the physician to this potential toxicity. Pharmacogenomics is referred to by some as precision medicine for everyone, and that's because about 75% of office visits involve drug therapy, and nearly everyone has in their genome genetic variants that affect how they will respond to drugs. Now, we know that not all drugs work in everybody. Efficacy varies by therapeutic indication and by class. We know that drugs like the analgesics are pretty efficacious, about 80% of patients respond to these drugs. But some drugs, for example, in the oncology space, have a very poor efficacy with only 20 to 30% of patients responding. Not only are drugs not efficacious in everyone, they sometimes do more harm than good. Adverse drug reactions are defined as rare, unintended, noxious outcomes occurring in patients who use drugs appropriately as prescribed. And although they're individually rare, collectively the incidence of ADRs is estimated at 2%. Some think this is a gross underestimate. In the U.S., ADRs are considered a leading cause of death among hospitalized patients. In economic terms, ADRs result in hundreds of billions of dollars in added costs. And these drug reactions are occurring across many therapeutic classes, including among some of the most commonly prescribed drugs like analgesics and antidepressants. So what is pharmacogenomics? It's using a patient's genomic information to improve the efficacy and safety of prescription drugs. The idea is that we'll try to identify patients who are likely to not respond, or patients who are likely to experience adverse drug reactions, and try and optimize therapy selection or drug dose based on those results. The goal of this course is to give you some baseline knowledge and skills to begin offering pharmacogenomic tests to your patients. The course is divided into 2 parts. Part 1 consists of 4 short videos covering the following topics: the molecular basis of drug response, pharmacogenomic information in the drug label, clinical validity and utility of pharmacogenomic tests, and pain for pharmacogenomics. For Part 2, we'll move to a webinar format where we'll have an opportunity to have an interactive discussion around additional topics. For example, which patients are candidates for testing, how to communicate with those patients about pharmacogenomics, and how to select a laboratory and a test. There are a couple of exercises that we'll review together, and plenty of time for discussion, both during the webinar as well as through the online discussion forum. At the end of the course, there's a short quiz to test your knowledge. So if you're ready to get started, it's time to go to the first video on the molecular basis of drug response.